Hi, it's Dr. Stuparich, endometriosis surgeon in Orange County in Southern California, and it's time for another Manuscript Monday. I wanted to talk to you all today about this article here entitled Drospirenone Promotes Apoptosis in Ectopic but Inhibits Proliferation in Eutopic Human Endometrial Stromal Cells today. Drospirenone is a fourth generation progestin that you all may have heard about because it is the active progestin in Yaz and Yasmin birth control, as well as the sole medication or progestin in SLIND. Now, in the endometriosis world, we tend to hear about other progestins like norethindrone or Dynagest, or even micronized progesterone, sometimes referred to as prometrium, more frequently than we hear about drospirenone. Okay, let's get into the details. So the authors recruited patients who were undergoing surgery for endometriosis, cysts, or endometriomas. And from each patient, they procured a tissue sample from the endometriosis cyst itself, which is the ectopic ESC, which you see right here, that stands for ectopic endometrial stromal cells. And they also procured a sample from the lining of the uterus, or endometrium, which they labeled the EU ESC, or the eutopic endometrial stromal cell. What they then did was they prepared each of these cell lines to bathe them in a 1 micromolar solution of drospirenone, and then analyzed for specific markers that are related to proliferation and programmed cell death, or apoptosis. Now, this is a super tiny graph over here, but when they compared the control with the cell lines after treatment with drospirenone, they found that there was a significant decrease in the cell viability of the eutopic ESCs, which is right here, and an even more significant decrease in the ectopic ESCs, which is over here. Now, typically therapeutic dosing of medications isn't typically measured in this micromolar concentration that you see over here. We're usually measuring it in nanograms per milliliter or something similar to that. So the authors actually make it a point to try to explain how this would correlate to an in vivo situation. So this 1 micromolar concentration of the drospirenone corresponds to 36.65 nanograms per milliliter. When you look at 3 milligrams of drospirenone, which is what we typically see in the combined oral contraceptive pill, this will get you up to 20 to 25 nanograms per milliliter, while the 4 milligram drospirenone only pill, aka SLIND, will actually give you a peak serum concentration of around 41 that you see here. Given that 30 nanograms per mil is considered sufficient for endometriosis suppression, they felt that the in vitro experiment was reasonable and clinically relevant. Now, I am an endometriosis excision surgeon, so I see every single day the power of what a well-performed excision surgery can do for a patient. So in no way am I suggesting that we swap out excision surgery for hormone therapy, but there is a real discussion to be had about the role of hormone therapy, especially after surgery. And while discussions, I think, very commonly involve applications of norethindrone, Dynagest, and even micronized progesterone, as I mentioned at the outset of this video, I think it could be quite helpful to consider adding drospirenone to that discussion if we're not already doing so. As always, let me know your questions and your comments. Thanks for listening.